Hello, my name's Hares. I'm one of the congenital electrophysiologists here at Leeds General Infirmary, and I'd like to talk briefly about reveal loop recording devices. Often, if you or your child is suffering from palpitations or collapse episodes, it can prove very difficult to get an accurate recording of your heart rate at the time. In many cases, the palpitations don't last long enough to get to your general practitioners or to a hospital, and therefore it can be very frustrating, and families often find that it takes a long while to get to the bottom of whether those episodes are related to the heart or not. A reveal loop recorder is the next step on from 24-hour tapes and an alive call monitor, which often will have been tried either by your local hospital or by some of the other paediatric cardiologists before you're referred to me for a specialist opinion. What a reveal monitor is, we've got one here, it's a really small piece of very up-to-date technology. That monitor contains a battery which lasts about 3.5 years, and a recording device, and also a transmitter. And I'll talk more about that in just a moment. In children, we put reveal devices in under general anaesthetic because they can be a little bit uncomfortable. And the procedure itself takes about 5 minutes. After you've had a general anaesthetic, I also put a little bit of local anaesthetic in, just next to the breastbone, and I make a small cut of about 1 centimetre across. It goes directly from left to right. I then implant the device, like this, just under the skin. As you can see, it doesn't take up a lot of space. Once the device is in a good position, then I either stitch the skin closed, or in some cases, just use sterile glue. If we have used stitches, all the stitches are dissolvable. Most children then wake up from the procedure and go home the same day. We always give out advice on how to use the devices before people leave the hospital. They come with an external activator, which is a bit like a key fob to activate a car locking mechanism. And if a child or a young adult experiences palpitations or an episode of collapse, the family can then press the remote device over the implantable device, and it stores the recording of the heart rate within the device's memory at that time. We also provide a remote monitoring system which can be plugged into the electrical circuitry at home. It's basically just a Wi-Fi router. The device can then talk wirelessly to that and automatically send us the recordings through the internet. And the positive thing from that point of view is it means that families don't necessarily need to come up to Leeds for us to review them. We can see what the heart rhythm has been at the time of the event. In the majority of cases, that allows us to either say, yes, this collapse was due to the heart, or no, it wasn't due to the heart. And that can be really useful in terms of working out what the next appropriate step for treatment is. Implantation of the device is relatively risk-free. As with any device that you're putting in under the skin, there is a small risk of infection, and we tend to cover our patients with antibiotics given into their vein whilst they're asleep. We don't need them to take medicine when they go home, and most children simply need to come back for a clinic review about once a year.